there is no cure for celiac disease currently. Hopefully there may someday be. Right now, the only treatment that's approved for celiac disease is just to avoid that gluten protein. Um, there is some emerging work trying to reverse those immune changes. So again, I talked about those inflammatory T cells really triggering the disease when they see those gluten proteins, and there's some work trying to reverse that, which could effectively be a cure for the disease. But that's there's a lot of promise, but we're definitely not there yet, unfortunately. And then the question about whether different types of wheat grown in the US or elsewhere could be involved with the increasing prevalence of celiac. And the answer is probably not. Maybe I should back up a step and first make sure that first, what I'll address is the issue of celiac disease specifically. So that's this very specific abnormal immune response to these gluten proteins. That's distinct from potentially distinct from gluten intolerance. We often think of gluten intolerance as being, or I think of it as non-celiac gluten sensitivity. So individuals who don't have these same immune changes, but still have symptoms with eating gluten, and it's probably a separate disorder. So with regards to celiac disease specifically, just looking at epidemiologic data, there's actually very similar rates of celiac disease around the world. And that includes Asia, Africa, Europe, and the US. So it's probably unlikely that differences in the types of wheat or in agricultural practices in the US are driving the rise in disease that we're seeing worldwide. That said, if you go back to literally ancient history, we do think that celiac disease as a disease probably began to be an issue with the rise of agriculture in general. So, and we know if you are never eating any of wheat, barley, rye, any of the grains that contain those problematic proteins, you will not get celiac disease. So you do need to be eating them, but differences in wheat between the US and elsewhere around the world, I don't think can explain the increase in the rate of celiac disease. The gluten sensitivity, so unfortunately, we don't really understand very well what drives that condition. So it's hard to say. It might actually be a response to components in processed foods that contain gluten, but not an actual response to the gluten itself. So it's kind of, I think there's a lot more unknowns about that condition right now. Could it be related to agricultural differences between here and elsewhere in the world? It may be, but I think we just don't know enough about it to say.